All right. Good afternoon, everyone. Welcome to all of our participants and guest presenters today from Southern California and beyond. I'm Andrea Mori, and I work with Riverside University Health System and the Public Health Department. And I'm our County Nutrition Action Partnership Coordinator for Riverside County. As a CalFresh Healthy Living partner, I work with our local communities to advance healthy food and physical activity initiatives. Whether you're a school food service provider or an advocate and supporter, we're happy that you found us today. Thank you for joining this webinar as we discuss policy, participation, and preparation to continue serving our school meals and prepare for the shift back to campuses eventually. You see my background. One day this will be back to noise and salad on the floor. So I'm really excited to get back to that new normal as soon as we can. This presentation features a variety of guest speakers today who will share their experience, encouragement, and excellence with you. If each of you can gain at least one seed of inspiration from this session, then we've been successful. I'm so glad you're here. We're going to start with a few logistics for the meeting, do a couple introductions, and then we'll get on to some exciting conversation. If you have any technical difficulties, please sign off and try again. If it continues, you're welcome to use the chat box to get some support. You're currently in listen-only mode, and that will prevent any audio feedback for us. We are recording this webinar, and the slides will be posted and emailed at the end of the webinar within a few weeks. If you have questions for the speakers, you can enter those into the Q&A box, and we'll also be keeping an eye on the chat to see if there's anything we can respond to right away. With that, I want to introduce Gina Osborne, a registered dietitian from Orange County Healthcare Agency.
Thank you, Andrea. So first, I just want to thank you all for joining us this afternoon. And as Andrea mentioned, I'm Gina Osborne, and I'm with the Orange County Healthcare Agency CalFresh Healthy Living Program, and I coordinate the County Nutrition Action Partnership here in Orange County. And so almost all local health departments in California have a CNAP collaborative as part of the CalFresh Healthy Living Program, which is federally known as SNAP-Ed. And the structure of each CNAP may be different, but they're similar in that they represent a variety of community-based organizations, schools, food banks, healthcare providers, community leaders, government agencies, and other public health organizations, all with the goal of transforming communities into healthy places where all residents can thrive. Here in Orange County, our CNAP priorities are to increase food security and to decrease food waste, and our overarching goal is to increase the number of CalFresh eligible individuals with access to sufficient healthy foods. Some of our projects include establishing a food waste task force, creating a How to Get Food Help in Orange County resource and training, development of the food assistance and OC flyer in response to COVID, and then a calendar of messages to coordinate nutrition education efforts amongst agencies across the county. And so now I'm going to pass it on to Robin, and she will talk to you about the San Bernardino CNAP.
Hi, greetings from San Bernardino. My name is Robin Ronkus, and I am the San Bernardino County Nutrition Action Partnership Coordinator. And I work with many of our community partners, and our goal is to increase access to healthy foods, address food insecurity, and promote physical activity. As a prioritization with our CNAP in San Bernardino County, we have prioritized school meal access, and we support schools in all that they do, whether it's to help them provide education, resources, and other support. We have a school meal access collaborative, and we have a number of dynamic co-chairs. One is Betty Crocker from Redlands Unified School District, and you'll hear from her later in this program. We also have Daisy Munguia, who's with No Kid Hungry, Robin Hernandez, who is also with No Kid Hungry. She's on maternity leave right now, but we've adopted Andrea Cuellar, who has organized this webinar, and we're so thankful for her. And I think we're adopting Tommy Lee too. Another individual from our School Meal Access Collaborative is Julie Calderon with Adelanto Elementary School District. And all of them have been so influential and powerful in providing information and resources and inspiration to all of Southern California in providing access to school meals as well as best practices. My CNAP has an upcoming meeting on February 17th, a Wednesday. If you are interested in being on my CNAP email list, I'm going to put my email address in the chat box as well as it's on the screen right now. So thank you so much. And I think the next person will be Fatina from LA County, and she is with the Nutrition Access LA.
Okay, thank you for that introduction, Robin. So hi everyone, my name is Fatin Darwish. I am the CNAP coordinator for Los Angeles County. We recently renamed our CNAP group to Nutrition Access LA. Our goal is to increase healthy food access. We do that primarily through promoting food assistance programs, particularly CalFresh and WIC. We also have an upcoming meeting, so I want to put that plug in too, on February 25th from 10 a.m. to 12 p.m. So if you are in the LA area and you are interested in networking opportunities, how to get more involved, how to promote and also learn about food resources, we would love to have you. My email is on the screen, but I'll also put it in the chat. So thank you all, and I appreciate you all coming today. I guess I'll pass it over to Andrea.
Thank you so much. Yes, Riverside County Nutrition Action Partnership meets quarterly. Our next meeting is the end of February, and we welcome anyone to attend. Most of you are here because you followed a CNAP invite from one of your partners in one of your counties. So thank you for staying active and promoting the activities in your county CNAP work group. With that, I wanted to introduce Andrea Cuellar, the program manager at No Kid Hungry. And without No Kid Hungry, and we just wouldn't be able to put this webinar on today for you guys. So thank you so much. And here's Andrea.
Hi, Andrea. Thank you so much. My name is Andrea, and I am the program manager for the No Kid Hungry campaign. I oversee the Riverside County and the San Gabriel Valley. Today, I'll be providing you with some updates about what we've done and continue to do during these uncertain times to help end child hunger. As an organization, we are committed to diversity and equity in our grants, especially supporting communities of color and rural areas that have been disproportionately impacted by COVID-19. Since March 2020, we've provided over $65 million in grant funding to 1,783 organizations, with 69% of our grants have gone to organizations working primarily in communities of color, and nearly 1/3 of our grants have reached rural areas. Another one of the things that we've done, we've created a texting line and a meals finder map with information about how to find meals and access resources like SNAP. This is where caretakers can text the word food or comida to 877-877 and find a site near them. We have also created 2 toolkits. The first one is School Meals Media Toolkit, and it's intended to help food nutrition staff connect kids with the meals that they need by getting the word out to caretakers in both English and Spanish. This includes graphics that can be copied and pasted, and a script that can be used to be recorded, to record a short video, and you can post this video in your social media. The second toolkit is about strategies to increase meal participation, and it features tried and true strategies from food service directors across the nation. And what I think it's really neat about this toolkit is that it has 4 different sections, and each section is simplified by using bullet points. Both of these toolkits are super easy read, and they have a lot of useful information. A friendly reminder and invitation is that No Kid Hungry is hosting its 3rd annual Rural Child Hunger Summit on March 23rd and 24th. This will be a virtual event, and the goal is to highlight some of the disparities driving child hunger in rural areas, identify practices, policy, and celebrate innovations that are community-based. And last, we are working on launching a CEP work group. 2020 truly showed the world 2 things: the impact of school meals on child nutrition, and the power and heroic efforts of school nutrition professionals. So one of the biggest questions we heard from school nutrition directors across California and the United States is, how can we ensure our school meal programs feed all students and still generate revenue? Tommy, if you can go to the next slide. Community eligibility provision, or also known as CEP, is one possible option, and No Kid Hungry would like to help you navigate this program. This work group will focus on resources, tools, and tips to help you get through the process. And we will be conducting 3 to 4 peer-led and expert-driven interactive workshops during the CEP election period. So if you're interested in joining the work group or know a colleague that might be interested, please sign up, and we will be sending this flyer with our post-webinar resource packet. Thank you.
All right, thank you, Andrea. I want to encourage each of you, if you have questions for the panelists, to put them in the Q&A, and we'll be doing a Q&A session at the end of all of the presentations, so that all of our speakers can have a chance to respond to your question. Each of our guest presenters have 10 minutes today, so if I'm interrupting you, it's because we need to get on to our next speaker. But first, I want to introduce Azusa Ortega from Feeding America Inland Empire, Riverside and San Bernardino counties. Thank you so much for being here and sharing a bit about your food bank and how the farmers to family food boxes have really increased healthy food access.
Good afternoon. Thank you for having me. Like Andrea said, my name is Azusa Ortega, and I'm the Programs Department Supervisor here at Feeding America Food Bank. We serve the Riverside and San Bernardino counties. And I'll be talking a little bit about who we serve in our children programs. It's our low-income school-age children and their families. So the way we select schools is by going off the low in price reduced meals. We select them by the low income. Next slide. The 2 programs that we have is the Kids Market program. And this was the previous program that we had, which we discontinued in 2019 due to the pandemic. It was paused. And our current program is the Farmers to Families Food Box program. This one currently began in 2020 due to the pandemic. So it was a change in program. The Kids Markets program, which was 2019 and before. It is a children's farmers market operated at specific low-income elementary school sites. So we operated just like a farmers market, but for children. And our FARSB driver delivers a truckload to schools, and FARSB staff helped operate with the help of the school volunteers. We were serving at the time 5 schools in both the Riverside and San Bernardino counties, and we distributed between 8,000 to 12,000 pounds. This was per month, per school, at each of the school sites. Each student would take home about 10 to 12 pounds each per distribution. And we distributed both perishable and non-perishable, including fresh fruits and vegetables. And the thing with this program was that it was only supplemental, so they weren't able to provide full meals. It was more like we gave them the pasta, the spaghetti, they provide the food and something like that. They're not able to do full meals. So next one. These are pictures of the kids' food market in one of our schools. There's our truck that delivered. There's all the students. They would line up, and they would line up with bags, and then they would be provided with the fruits and vegetables. And there's a picture of the fruits and vegetables that we provided. We always try to take a variety of both fruits and vegetables, and then we had volunteers from the school, or sometimes the students would help us. The upper grades would help us. So next slide. Our Farmer to Families program in 2020. It was food box deliveries to specific districts serving students and their families district-wide. So we deliver to the districts, and then they are in charge of distributing to all the schools in the district. The district operates in conjunction to their district grab-and-go food distributions that they already have in place. So this is pretty nice because they're not starting anything new, and it's not Anything new, they just do it in conjunction to what they already have in place. Our drivers deliver pallets to farm-to families, deliver pallets of farm-to-family boxes and pallets to the different districts. And they also take a truckload. We serve 10 districts currently in both Riverside and San Bernardino counties. And we distribute around twice the amount of pounds as kids markets per month. Each student takes about 22 to 36 pounds approximately each per distribution, and they are both perishable and non-perishable, including meats and other proteins. So the nice part about this is that the food boxes do make complete meals. So it's a little bit better than before. The grab and go program, these are pictures of our deliveries. This is our driver delivering to a district. They deliver in pallets and, like I said, a whole truckload. And these are the items that are in the boxes, more or less. It's fruits, vegetables, milk, tuna, spaghetti sauce, rice, and rolled oats. The difference between Kids Market versus Farmers to Families Food Box Program. The Farmer to Families Food Box Program works in conjunction with district grab and go programs and serves all schools district-wide, servicing more students and their families versus the Kids Market. They serve school-wide only. So this is a really good thing because it allows us to serve more and more households, more families. And the Farmer to Families Food Box Program does not require our staff to operate other than the driver delivering versus the Kids Market. It's operated by our staff and it makes it more limited. So therefore, that's why the Farmer Families is better because we're able to do more. And the Farmer to Families Food Box Program provides products for full meals versus Kids Market product is only supplemental. So it provides a little bit more. And we're trying to continue with this program that we currently have. The question that was asked was how can a district or organization join the Farm to Families Food Box Program? Currently, we're serving mainly districts, and the reason why we're serving districts versus organizations is because districts can take full truckloads and they serve more households. Versus organizations are usually serving a smaller amount of households and people. Therefore, Farmer to Families is focused on low-income school districts located in the Riverside and San Bernardino County. So you do have to live within those counties in order to be served by us. And it is a limited program based on awarded allocations and amounts we have available. So we only have a limited amount for limited districts. And if interested right now, districts must complete an inquiry form and district will be placed on a wait list. So therefore, if anybody is interested, if any district that is not currently being served is interested, you can go ahead and email me and I'll send you the inquiry question form so that way you can fill it out and be placed on a wait list. And that's my email, I'm Azusa Ortega, and my email is aortega@feedingamericaie.org. And then for community-based organizations that are interested in ongoing distributions, you may apply for partnership. It's located on our website. It's an application process that requires supporting documents, an application fee, and open enrollment is only happening 4 times out of the year. All our information is on our website and it's on feedingie.org. And if you're interested, feel free to, visit our website. And if you have any questions, you can also email me. Thank you for having me. That's it. I don't know if anybody has any questions.
Thank you, Azusa. We'll save the questions for the end of the presentations.
Okay.
I do want to encourage you, we're getting a lot of questions about different regions and counties and how do they get their school districts involved. And so I would highly recommend, if you're not connected with your local, regional, or county food bank, that you do. Feeding America is statewide and nationwide. So look up your local Feeding America food bank to find out how you can get access to some of this food box programs. Yes. It is slightly different in every county and region. So thank you so much for sharing about Riverside and San Bernardino counties.
Thank you for having me.
All right. With that, we're going to proceed with an update on pandemic EBT. with Angeles Nelson. She's a policy advocate from Nourish, California, and she's going to share what to know and what to expect about the next rollout of pandemic EBT. Thank you so much.
Thank you, Andrea. Like she said, my name is Angeles Nelson. I'm a policy associate with California Food Policy Advocates, and I specialize in school meals and advancing policy that improve access to school meals, also for immigrant California. Next slide, please. So today we're going to talk a little bit about a survey that we did in a report, and we'll go over some key findings on school meals. And then we'll go into a quick overview of PEBT and more in detail about PEBT 2.0, including school-age children. And since it has been expanded, we'll also talk a bit about children in covered child care facilities. Next slide, please. And we did a survey, and we also have statewide research, and we conducted it in 3 phases. We have a stakeholder interview among Nourish California networks, and that included all the way from San Diego to North California. We did many interviews, and we also did a survey. About 1,000 people responded to the survey, and they were middle and low income Californians. And the respondent had to be a household income of $50,000 or less to qualify to participate. The interviews were conducted between October 20 and November 13 of 2020. And the interviews were also conducted in Spanish, Vietnamese, and Chinese. And we have 6 focus groups among middle and low income Californians. And some of them were in Los Angeles, the Bay Area, and the Central Valley. Next slide, please. This research was conducted with FM3, and we had a section specifically to address school meals and many questions for parents with young children and school-age children. Nearly 7 in 10 parents say that the children ate meals at school. So you can see that school meals are really important for parents of young children and for children who are going to school and childcare also. We have about 68% of those families reported that they did their child eat school meals. And from those, 85%, their child ate free or discounted school meals. Next slide, please. So school meals are really important for low and middle income families in California. And they are very valuable, and they are very valuable, very convenient, and they allow parents to save money. More than half of the respondents reported that they find the school meals to be convenient. They allow their family to save money. They allow their child to eat a hot meal with other students, and they ensure that their children are eating healthy food. Those are some of the reports. I'm gonna go really quick, but you can visit our website for more details, and also these slides are gonna be sent to you. The next line, please. Since the pandemic started, more families report relying more often on free and discounted meals. About 63% reported that they rely on food from the school more often or somewhat more often. And about 17% of the families reported that they rely less often in school meals. Next slide, please. So we wanted to ask you what were the challenges for accessing school meals? And the main challenges, the main one was air quality. So poor air quality to go outside and get the meals. And this might be because right at that time is when the fires were in California. And we will see later on that children with younger kids have a more difficult time getting outside and going and getting the meals from the school. Also, they find the meal pickup times very inconvenient. More than half of them reported this. And this can be especially with families that have small children because they can't leave them at home. And many people reported that they were also scared of getting COVID or um, having their children more exposed to getting sick and to the poor air quality. About half of the parents reported that they had no information on when and where the meals were available. And also about a bit more than half reported that they have experienced low quantities of school meals available. And that could have been because the school was closed and they didn't have meals at their regular school, or when they went to a school, they didn't have any more meals available for them. One other big challenge that we found was the transportation issue. And that also had to do with families not having a school nearby that they could walk to and access meals. Um, and then the other one was the lack of information in their language. So about 38% of families reported that they would like to have more information on their language. Next slide, please. There were also, we look at different parents, different like Latinos, people of colors, and what were the difference on those race and ethnicity, if the challenges affected them differently. And in this slide, as you can see, white parents were more likely to say that they didn't have information on meals and that they had limited transportation. Next slide. And in this slide is what I was mentioning earlier, that if parents with young children feel that going outside was one of the biggest challenges. And you can see the different numbers here from less than 5 years, 5 to 12 years, 10 to 18 years, and 19 plus. They have the least amount of trouble going outside or picking meals at the time that the schools serve the meals. As the children get younger, it seems to have more challenges. Next slide. So one of the things is that the parents really like to have schools and have the ability to access meals at the school. Many of the parents reported that they felt that when the school was closed and they could go and pick up meals, they did because they find it very valuable. They find it convenient, and they find it good for their budget. And they did have some of them express that the quality of the food, the kids didn't always like it and they didn't always eat the food, but they did feel the support of accessing those meals, and they felt that it was relatively easy to get to access to those meals. Some of the schools asked for an ID and some of the schools didn't ask for that. The major barriers that they reported were the big lines for picking up, the inconvenient times, and the distance to the school. And I have seen, we talked to a lot of people, and because they are trying to homeschool their kids or they are setting up their skills for the kids for the schools, they find that if the meal pickup times is during that time, it's very difficult for them to leave the younger kids and go and pick up the school meals. Next slide. So I'm gonna touch a little bit about pandemic EBT. And for those who are not familiar with the pandemic EBT, It's a program that provides food benefits to children who are eligible for free or reduced price school meals and who has been affected by school closures due to the pandemic. So far we have 3 pandemic EBT issuance. The first one we call pandemic EBT 1.0. The second one is just for a couple of months. And the third one is PBT 2.0. During the summer of 2020, we had 3.7 million school-age children receive benefits for March, April, May, and June. Each child received about $364, which was more than $1 billion in benefits that were distributed in California. And close to 95% of the students receive benefits, which is a great amount of kids in California, and the CDSS and CDE did an amazing job on reaching all these kids in a very quick turnaround time. Still though, because California is so big and we have so many students, about 200 kids were left out without receiving their benefits. Next slide. And the PBT extension was 2 months, August and September. And we will just go ahead and go to the next slide so we can cover the next. We still have the PBT helpline open, and that's for assistance with the PIN setup, request replacement cards, report lost or stolen card, request a change of address. And there's 2 really important things that we need to share with families is number 1, that the PBT benefits does not impact the child's immigration status. And the number 2, that PBT benefits do not substitute school meals. Families can continue picking up meals at school. Next slide. And the next PBT, the 2.0, California is currently working on a plan to extend benefits to all children eligible for free or reduced meals for the entire school year 2020-2021. So the benefits will go back to October. And the USDA guidance just released on last Friday, January 29, and they had a call today to explain the guidance. So what I'm gonna talk from here on is all, it hasn't been approved, it's not on the plan yet, but it's the guidance that USDA provided for all of the states. So the eligibility for PBT 2.0 is all of the children who receive free and reduced meals, and that includes children who attend school in CEP, in P2 or in P3, or who are directly certified, regardless of their income. So for instance, if a child is in a school that is in CEP and only provides breakfast, all of the children on that school will be eligible for PBT 2.0. And the other eligibility criteria is that the school is closed or has reduced attendance or reduced hours for 5 consecutive days. Next slide. The PBT 0.2, we are going to have a new benefit that is a snack, and that is gonna increase the daily total to $6.82. The benefits are gonna be retroactive to October, and we are going to use the best feasible available data to determine the status of the schools. So if the school is in distance learning or if the school is hybrid, those are things that the California, the CDSS is still working through. How is the process for determining benefits? What are the simplifying assumptions that they can take? What are the average benefits for distance learning or hybrid learning? The first issuance is probably going to be a few months, and then it might be monthly issuance or it might be bi-monthly. Some of the states are doing every quarter. So those are things that are going to be worked out in the near future. Next slide. And the PBT for children in covered childcare facilities, the eligibility is that the child must be a member of a household that receives SNAP benefits. and it must be enrolled in a covered child care facility. Child care facility is closed or has reduced attendance or hours for at least 5 consecutive days. The benefits are going to be similar to school children in the same area. Children under 6, and this is something new, which we are really thankful for USDA guidance. The children under 6 are automatically deemed enrolled in a child care facility, and most of or all of the PBT beneficiaries might receive their payments automatically based on existing state and school district records. And like I said before, this is all on the guidance. It is not yet on the plan. So we have to, CDSS have to get that plan approved. And there is going to be a stakeholder meeting with CDSS on February 18th from 1 to 2:30. And I think everybody's invited to provide some guidance for this new plan. So what can we do to help? Yes.
The link is in the chat for the pandemic EBT. And sorry to interrupt you.
Yeah, this is my last slide.
To the next. So, yeah. And these slides will be sent to you all so you can review them and click all over the place.
Thank you so much.
Thank you so much. I wanted to cue our poll question and introduce Daryl Hickey from Pomona Unified School District, our Food and Nutrition Services Director. We're going to spend a little time talking about human resources and how to create a safe working environment. So we were curious about how your morale is going recently. So if you can see the poll, go ahead and respond. And once we get enough responses, we'll go ahead and show the results. I want to say thank you to Tommy for pushing all the buttons today. All right, it looks like we're in a good place for the most part, doing all right. I'm hoping that the next two presentations for you give you a real look at how two school districts are dealing with their staff and their HR and union issues and just trying to keep those meals moving right through. So with no further ado, I'll introduce Daryl. Thank you so much.
Good afternoon, everybody. It's an honor to be here. My topic is creating a safe work environment. And so first, I just want to introduce myself. I'm Director of Food Nutrition Services for Pomona Unified School District. I've been in school food service for over 23 years. 18 of those years have been here at Pomona Unified. PUSD has 41 schools with a total enrollment of a little over 21,000 students. Food and Nutrition Services, we provide breakfast and lunch service with 250 employees supporting that role. Our district has a separate child development program that oversees our state preschool and our Head Start programs. So they administer their own CACFP program separate from our program. However, we do vend the needed items to them. Our district is 100% CEP, and we've been that way for the past 4 years. One thing that we do in our office is we've talked about, if you've ever heard the term pigeonhole, for those that don't know, it actually has historical reference. It goes back to the days of like Civil War time and World War I, when communication was sent via pigeon, carrier pigeon. And so what they'd actually do is they'd have different pigeons that would do different things. Some would go short distance, some would go far. And then over time that got changed to, because since they had specific jobs, that over time got changed to, if you ever have seen a roll top desk, some of the old antique roll top desks, when you roll them up, they actually have pigeonholes, little sections to store different things. And so basically over time, pigeonholes come to mean it's certain things that mean certain things. And so I bring this up because this is something that we've instituted in our office. You have certain situations or problems or policies and procedures, things that you've experienced and that you've gone through. And so you go to that pigeonhole to get that answer or to get to that response. So we spent years and sometimes decades fine tuning these responses to various situations. The problem is that we never had a pandemic pigeonhole to go to for answers and for guidance. So, with today, I'm not expecting that I would share any groundbreaking information or the meaning of life. But my goal today is just to kind of share the path of how we've gotten to this point, and maybe at least having that shared experience can be of value. And also to let you know that, we're all in this together, we're not alone. And I think for us, that was one of the first things that was very helpful. When this all first happened, I feel like we all kind of retreated into our own districts and tried to figure out our problems. And there was a lot of panic, there was a lot of unknown, not realizing that all of our peers had the same issues. So sometimes just knowing that others are going through the same situation will provide that comfort. So being able to partner up with neighboring districts, colleagues, or peers helps us all through this. So for us, it started the afternoon of Friday, March 13th, around 4 o'clock. I was pulled into our office, our district office with the emergency meeting. And that was when we were informed that the entire district would be shutting down because of COVID. So everything was going to stop, but just like everything, food service continued to go on. So my first thought was no problem. We've got employees, we've got staff, we've got food. Trying to figure out how are the kids going to get into our cafeterias since they're all closed. So that's when we were informed, oh no, you got to feed the kids, but you can't go into the kitchens. So we were trying to figure out how we're going to go about doing this. So at that time, curbside service was not even a concept. So we were left thinking, here it is Friday afternoon, what possibly can be done? Everyone's gone home, we have nothing in place. So we spent the following Monday getting a makeshift meal prep set up in our district warehouse, and we started packing breakfasts and lunches to hand out the next day. One interesting thing for our district is very spread out, and we have different populated areas. We have high density population areas, and we have some areas where 70 to 80% of the students are bused. So we are trying to figure out what areas would be most impactful. So in an attempt to limit exposure, we're able to identify our highest populated areas, and at the same time identify schools that could handle the traffic and the curbside and the foot traffic for distribution. So we opened up 7 sites and provided daily pickup for breakfast and lunch from 7 in the morning till 9:30. I know some districts will do 1 day a week, Monday, Wednesday, Friday, Tuesday, Thursday, there's different things. But what was felt best at this time was the majority of our families bring their kids in the morning. So whether it's on their way to work or they get dropped off, whatever it is. And so we felt that maintaining this would work out great. And the thing is, we started, thinking, oh, this is just going to last a couple days or maybe a couple of weeks, but obviously it went into a longer time. Then once we had the 7 sites going, we decided to expand to an additional 5 sites, bringing our total to 12. We added additional sites that were kind of right outside of our little areas that the sites were currently servicing to make it a little bit easier for families. We had a lot of families that would walk, so to make it a little bit easier for them as well. And that at that time, we have, in our district, we have over 500 special diets, everything from chopped, blended, pureed, renal diets, special needs diets. And so we opened up a specific site. It's not open to the general public, but it's open specifically for those families that we've reached out to that need a special diet. So we settled into this pattern. We had 12 sites going, and we were doing about 3,300 kids a day, both breakfast and lunch. The family said they actually enjoyed the daily interaction. They said a lot of times it was the only opportunity that they had to get out of the house. Plus, it was a way for them to get information daily with what was going on. So during this time, we put into place our proper PPE and procedures for safety for families, mask wearing, social distancing, putting things in the trunk. The initial thought that this was end soon, but slowly the reality kicked in that it would last for a while. So in order to protect employees from exposure in the elements, because at this time it started to get really hot and we started to see a lot of the employees, most of them are working inside and that's what they're used to, but to be outside in the elements really became a challenge. So we implemented for safety a team A and a team B rotation. So each team would work 2 weeks and then rotate and then be out on call. This protected the staff from the elements, from burnout. In the event of an exposure, we could rotate out a team and bring in the standby team. So our teams have experienced rain, extreme heat, wind, falling ash from brush fires, and even earthquakes. So we even had one experience where we had to shut down a site temporarily as a SWAT team initiated a warrant across the street. So we've really experienced, I think, pretty much everything during this time. So from June until about September, this rotation worked out well. We had actually 5 instances in which we had to rotate out a team, but our community never noticed and services remained seamless. This rotation worked very well up until about November, when things started to really become a challenge. I started to lose team A, and then half of the team B was out due to exposure. This is when we really started to see an impact of COVID, and the cases started to go through the roof. So in December, it was determined that if we did not make quick and immediate changes, we would not be able to sustain what we had in place. So we closed the 5 that we opened up in the second phase. We closed those to create teams C and D. Those 5 sites were already located near sites, so there really wasn't a big impact for our families. So we're trying to stay on top of things, because as we close sites, even as I close the site to capture those 2 teams, I would lose another team because somebody became exposed. So our goal was to make it to winter break, so at least we could find a break and have everybody stay home and stay quarantined. So we handed out 5-day meal boxes and extra food to cover them through the time. So this allowed our family, or our staff, to stay at home for the winter break and to rest up. So coming back in January, it was probably the worst month since we've started this. We ended up spending nights and weekends trying to keep track of all the people who were sick and were exposed. In the first week of January, I sent out 8 condolence cards to employees. We've had employees lose husbands, grandfathers, and grandmothers. You know, wearing a mask has taught me how much we rely on facial expressions for those that we talk with and engage with. I've really had to learn more to listen to the actual words and to really try and read someone's eyes. You know, we all learn and focus our energies on managing our budgets, lowering food costs, and monitoring labor hours, managing commodities, and make sure we're compliant in all areas. But when an employee looks at you in the eye and their eyes start to tear up and they start to cry and tell you that they're scared, it really changes the focus of what's going on. So we have the food thing dialed in, but now our focus is really changing for a lot of us. So there's now a shift in our focus, and our focus is on making sure our staff is taken care of. Our focus is on reaching out to staff like never before. Our focus is on having those difficult discussions with staff who have lost loved ones. The kids will get fed and will continue to adapt, but at the end of the day, we are surrounded by real life situations. So our families have lost loved ones and lives have been changed forever. So in closing, I just want to share, as food service professionals, we continue with what we do. It's in us, it's our calling, making sure that those that are hungry get fed, and making sure those little faces, you know, get something that sometimes is only available through us. You know, I often reflect on a situation that happened to me early on this pandemic. As I was putting meals in the back of an old beat up van, I see 3 little faces turn around, they look back at me. Some of the kids were missing their teeth. Their faces, you know, had dirt smudged across their face and their hair was disheveled, but they were so excited to see what was in the food bag. That was like the highlight of their day. So, you know, you realize at that moment that this is bigger than all of us, that we're here to make a generation, to make sure that a generation has something as simple as food in their stomachs, to make sure that they can live and learn and thrive. Thank you.
Wow, Daryl, thank you. You really told that story. And I'm sure a lot of you have similar stories. But yeah, you really explained the challenges that you're facing and how it continues to change as the needs change and as it really gets closer to home. I wanted to introduce our next speaker, and that's Eric Holliday from Avalor Unified in Riverside County, to share a little bit more about the perspective on creating a safe work environment for staff.
Excellent. Thank you very much. Hello, virtual audience. Thank you to everyone here that's spending time making sure we're feeding kids and the community. Super important. So that's wonderful. First thing for us in Avalor, just some recommendations. Obviously, partner up with your maintenance and operations team if you have them. They have an abundance of funding for the CARES Act. So by partnering up with them, They've been the ones who are installing partitions inside of the kitchens. They've been responsible for putting down yellow marking tape. They've been responsible for really changing out the air filters in the buildings. They are ultimately responsible for taking care of the maintenance of our buildings. And so I'd recommend that you partner with them and use some of that funding that they have, whether that's purchasing PPE and really just leveraging the resources that they have instead of dipping into your own funds. So that's important. As far as keeping staff safe, for us, we have 20 sites that are open. And so for us, it's just been important to use our org chart and just like the MBA, keeping our staff inside of their bubble. And so for us, we've made sure that everyone knows who's on their team, what their responsibilities are, and making sure that they keep their distance of 6 feet for no more than 15 minutes in a 24-hour period. And they know who that is. We have had some COVID cases here, and there is, if you have everything written down and organized, it helps with the organizational process. For us, as people have had COVID or tested positive, it's been helpful to have that chart and to remind them who's on their team, because many times if asked about what you did last week on Tuesday and who you were with, sometimes your memory is not that great. So having everything written down allows us to provide that list to risk management and let them know who that person may have been in contact with, which has been a great network for us. So that's been helping. Also making sure that when they go on lunch that we've removed some tables, and if they're able to sit outside or just spread themselves out more than 6 feet. I know they are very social. We're all social. We like to be together, but for lunch, we definitely have to separate them out. So making sure that they follow those guidelines when they're eating lunch together, that they definitely keep their distance and sit outside as much as possible to get the fresh air. So that's been important. All of your sites are different. So whether that's marking tape, whether that's playground paint that you're setting up, but by this point, hopefully, 11 months in, all of your sites are set up where you kind of run a mock run through of how it's going to look when the kids do come back to your campus, and you've allowed your staff to see what that'll look like, because that gives them peace of mind. I think the unknown and the uncertainty has been one of our biggest challenges. So being able to do a mock run through of what it will look like when the kids come through and having the safety mechanisms in place have really kind of put our staff at ease, and they're excited for when our kids are able to come back on campus. So that's been good. I also recommend that having some backup sites in case one goes down, and you will have some sites that just stop running because we need people to run our sites. And when you get a COVID case, you will have to have some contingencies and plans in place. So make sure that those are set and you have those sites available. Also, as far as entering your building, for most of us, we're blessed with the kitchens to have the ability to have our staff only enter and exit from the kitchen. Many times when we first started, it was recommended that our staff goes through the office first to get temperatures and symptom checks and everything else. However, we wanted to boycott that and tell them, no, we'd like our staff just to go directly into the kitchen through the back door, get symptom checked there, temperature checked there, and that way they're only able to stay in their own bubble. And that has come in handy a lot of times as some of our offices have had COVID positive cases, and by keeping our staff completely separate from them and inside of our own bubble, we've been able to continue to operate even though the offices may have closed. So that's been helpful to us. Also, as the new year rolled on, it's very important because as any site that has more than 3 cases lately, and some of our sites have had that, they're now required to get a COVID test weekly and report those results until there are 0 COVID cases at the site. So we've been blessed to not have that happen yet, but it's even more of an incentive to keep your staff separated so that you do not have to worry about having COVID tests taking place every single week until you get down to 0 cases. So that's been important. Also recommend, promoting your strategies and efforts to the families if your kids haven't come back to campus, because ultimately when they do come back, they need to have confidence that the safety mechanisms are in place. Food services has always been safe. We have served safe. We've been even more diligent through COVID, but definitely keeping, everybody's making sure that even if they're at home, it sounds crazy, but, I've been recommending to have kids wear masks at home, or even them to wear masks at home, and to make sure the mouth and nose are covered, because when they come back to campus, they will be wearing masks. And so the more used to it they get, the more normalized it is, the better it will be operationally. Our staff took a while to get used to it, but 11 months in, hopefully everyone has found the mask that works for them, that allows them to breathe, that keeps the particles out, and that keeps them safe. So that's been important as well. But more or less, just loving on your staff, appreciating your staff, everything that you can do for them, and really throughout all this, control the controllables. So much you can control. You put the safety mechanisms in place, but we are dealing with our staff, and as human beings, we're all failable. So, just do your best to keep safety in the forefront and keep everything moving forward. Thank you very much.
Thanks a lot, Eric. Great to hear some of your great advice on protecting ourselves in our own bubbles. Lots of bubble talk in the chat for you. With that, I wanted to introduce Miss Betty Crocker. She's going to take it to the max today with her meal service increasing with her calf cap. Thank you so much, Betty.
Andrea, you are too sweet to me. Tommy, would you please hit the poll question that we have? And it's always wonderful to follow a couple of gentlemen in the industry, Holiday and Daryl. I just wanted to get your take on for your school district staff, only when it comes to CACFP supper meals. Can you just check all that will apply, and that'll kind of be our temp check on where we are with that. My name is Betty Crocker, and I am out of Redlands Unified School District. We are in San Bernardino County, and we have 24 schools, and we have 21,000 and declining enrollment across 4 cities. And Tommy, I don't know if you have this time, so I'm just going to let the poll run for a moment in case anybody hasn't done that. If you would go to the next slide, please. Thank you so much. And so one of the things that I have been saying to the leadership team of the Quad County Collaborative is serving to the max. We are a max serve site, or excuse me, a max serve district. And what that means is that whatever the USDA authorizes us to serve is what we serve. And so for the max serve on this one, what we are looking at is a 7-day meal service, 4 meals a day. That's 28 meals per child. And we also provide the USDA Farmers to Families. I have partnered with Feeding America, who was on here earlier, and we're just rounded the corner of 5.3 million meals since March 30th. Next slide, please. So, what is your quarantine name? How do you feel right now? And the last thing that you ate. This day it was exhausted Cheez-Its, and I'm sure many of us have felt similar to that. I just wanted to share with you kind of where we started, because 28 meals is a heavy lift. That is a huge volume of food. And on top of that, the Farmers to Family boxes is in addition to those 28 meals. And so where did we start? Well, we started at the beginning, just like all the rest of you, just like Mr. Daryl Kwok stated on March 13th, our life changed. Our kitchens were closed and we were pushed to the curbside. Where we started at Redlands is we started serving 1-day meals at a time. And here's a picture of my single-day meals. Next slide, please, Tommy. Our primary focus was to build capacity to handle the 28 meals. And in building the capacity, interesting phenomenon happened. Through our innovation, we were able to provide the capacity required, but our parents now became our customers. Prior, as Daryl was saying, he had the privilege to see the eyeballs of his kiddos. Well, we serve from 6 a.m. to 8 a.m. on Tuesday morning. We do it before distance learning because we do not want to interfere with the distant learning schedule. So when we did that, we quickly found out that we had to inspire our parents to come out, and we had to make this worth their weight. So with CACFP, that is our after school meal program. If you're not in child nutrition services, that means that we can serve a supper, which is a meal, and also a snack. And so with this 14 meal day crediting, we were able to provide a lot more to our kiddos and the families. So our top picture here is no CACFP. and then the volume of individually wrapped meals with CACFP. In addition, we can serve additional fruits and vegetables, and we also do bulk style with the crediting. Go ahead, Tommy. Thank you so much. Over here on the far left, I like to point out Josie, our nutrition specialist, who is, I asked her for some content help with this. And so what she did is on the bottom left here, we have, just so you can get an idea of the crediting, in other words, how much crediting, how much food can we provide each child. And there is a maximum and a minimum. And with the CACFP supper, which is a meal, and with the CACFP snack, in addition to the breakfast and lunch, you can see that there's quite a bit of extra components that we can offer. And this produces maximum results of investing in our students. And I kind of like this picture here. We are here for you. Next slide, please. So instead of Simon says, I call this Josie says. Our nutrition specialist said, I said, Josie, with CACFP, what can we get done? So number one, what CACFP has allowed Josie to do is she can provide us more meals in a bag. She can plan all of these meals. And as I said, showed you with the picture, it's just a greater quantity. We also have some cool produce options that she's put together. There's Farmer Bob on the top right. We were able to get a bunch of blackberries with the extra crediting, navel oranges, tangerines, apples, persimmons, dates, and local farmers. If you're familiar with Redlands, we have the famous Burge Mansion. We just picked up an entire truckload of oranges from those lovely folks. We have some cool dairy options. We were able to secure some bulk yogurt. Cool locals, such as our Cuca's Mexican restaurant. It's a well-known family restaurant. They have 3 restaurants here in the local area. Big hit with our families. Our extra crediting also allowed us to partner with our local Subway. And then our newest partner is our Old Town Baking, bottom right picture. We were able to get loaves of bread for our families. They absolutely loved it. We just started that 2 weeks ago. And then the cool, what I call the BIG, Stater Brothers. Yes, that's right. Stater Brothers came rolling in, and they provided us a lot of dry staples for our big holiday serve. Peanut butter, rice, popcorn. I remember there was oatmeal in there. And Josie also shared with me over the top cool. We just secured Costco spiral baked hams for Thanksgiving. We did big butterball turkeys. Butterball brought a couple of trucks our way. And then Cuca's tamales, their family got busy and built us quite a few dozens bags of tamales. Next slide, please, Tommy. And then, I left this slide in here from an earlier presentation. It goes without saying that we are all under USDA regulations. Whatever USDA says we can do is what we can do. And so when they made us dial it back and take off CACFP, we dialed it back. But as soon as they said you can serve the 28 meals, we serve the 28 meals. It has been quite a journey. Next slide, please. So this is what it looks like in my district. For the directors out there, or for just the community folks or community partners, the top, I don't even know my colors. The top green is what our CACFP meals are during the pandemic, and then the orange is what they were pre-pandemic. You can see that these are exponential. This additional programmatic funding and the policies that have supported us to keep all of our kiddos safe from hunger in Redlands Unified School District, we have provided. The numbers are exponential. Last year is 152,000 meals for CACFP, our after school meals program. This year through the pandemic, it's 2.2 million meals. And there's our exact numbers. Next slide, please. Focusing on building the capacity, there's just some ideas that we came up with. We created a grocery line, and then actually this is my Barbie car full of what we ended up calling pallet koozies to keep all of our koozies cold. We purchased a ton of Easy Ups. Next slide, please. Whoever thought we'd be first responders? That was news to us. Making it worth the wait. Here's a picture of our families lined up. They start lining up usually about 4:15 to 4:45 every Tuesday morning. On the bottom left, thank you, No Kid Hungry, for our emergency grant money. We were able to purchase a vehicle to deliver meals and any VIP services that we're partnering with our principals. And then in the middle picture, that's our Farmers to Families program. Go ahead. Just some more pictures. Shout out to Feeding America. There they are. Your drivers are the absolute most kindest drivers. Red carpet treatment. They're always helping us out with everything, getting everything on and off the dock, and no alarm clock is needed. Our passion wakes us up, right? Go ahead. Oh, and that was me as a kid on the bottom right. Always PRing it up, letting our families know what's coming up. We always give them their monthly calendar. And if you are looking for me or looking for additional resources, I'm going to give you our website, and you can find my email address on there as well. Next slide, please. Tommy, can you close that poll, please? I didn't realize that it was open. I'm so sorry. Whoever just sent, thank you. Oh my goodness. Talk about the picture that takes my breath away. In the middle of all of this, I moved my family to Redlands. What a blessing in the middle of the pandemic. And here's our regional directors that came to welcome me to the community. And they are all serving to the maximum. Great leaders don't set out to be a leader. They set out to make a difference. It's never about the role, always about the goal. Next slide, please. And there's our big thank you. Our poll, do we have the results, Tommy? Thank you so much. So it looks like 31% we are serving them our grab and go meals to all kids. Yeah, same here. And if you need any help with CACFP qualifications or getting your program started, USDA has authorized us to provide the program for all school districts right now. Okay, thank you so much. And I believe that was my last slide. Beautiful. Oh, those are black and blueberries. And our thank you from our kiddos. Oh my gosh, they just own our heart. And the far right picture, that's a full moon at 2:30 in the morning. We were there getting ready to do everything that we do to start serving at 6 a.m. Thank you.
Thank you, Betty. You guys are all up bright and early, even more so than ever before. I want to thank you guys for being innovative about getting your families fed before school, after school, on the weekend, whatever it takes, right?
Amen.
With that, I want to introduce Kristen Hillman. She's our Nutrition Services Director at Capistrano Unified, and she's going to share a bit about getting ready for the transition. I know some of our counties are already doing some hybrid learning, and it's really great to hear from you today.
Thank you very much. Hi, everyone. My name is Kristen Hillman. I'm the Director of Food and Nutrition Services for Capistrano Unified School District in South Orange County. We started back to in-person learning the end of September and transitioned a little bit slowly for all 55 of our schools throughout the middle of October. So our goal was to keep everything, our service models, everything as streamlined and normal as possible. We actually ended up losing and have continued to lose quite a few of our employees throughout this entire almost year now. So that's been a struggle trying to, fill the holes throughout the transition back to in-person learning. But we have found that everybody has pulled together super tight, and we've got a wonderful food service family, as you all do, and just trying to keep, like our wonderful gentlemen were saying, trying to keep everybody in pods to keep them safe. So of course, we added additional disinfecting protocols, lots of PPE, all those fun things. But just to keep that sense of normalcy, we tried to keep our actual service structure as normal as possible. Next slide, please. So our secondaries, we have students on campus 2 days a week, really. So they have different cohorts. Every Monday is virtual. And then there's a group of kids who are on campus like Tuesday, Thursday, a group of kids who are on campus Wednesday, Friday. every one of our secondary schools has chosen a different hybrid model. So scheduling has been really interesting. We have done our best to work with each and every one of our schools to try to get updates and information, but that's a really tough thing with the ever-changing world of enrollment and the school needs. So if you're going back to in-person learning, that would be something I would strongly suggest, is trying to work with each principal individually or as a whole to make sure that you and or your staff at the school site are in the know of what is to come. We have lunch and breakfast service at every one of our secondaries. It's pretty similar to normal pre-pandemic. We have window service, we have counter service, and then we have some carts outside as well. We've streamlined our menus at all levels. We have no a la carte. We used to have anywhere from 5 to 7 entrees available every day, a wide variety of organic and conventional fruits and vegetables, as well as some, cupped fruits or frozen fruits, things like that. We've tried to really streamline that to ease our production as well as food cost. At our secondaries, we have a very low volume of students, so our meal counts are fairly low at our secondary sites. It just seems like more and more of our middle and high school kids are choosing to stay online and not really come into the on-campus option whatsoever. Our take-home bags for those days that those on-campus kids are virtual are not the most wanted, and that's a struggle as well. There's a lot of stigma. I don't think it's understood that these are free necessarily for all. And so we're trying to really get that out to our administrators, work with our ASBs, even with our athletic directors to kind of nudge the students to grab these bags on the way out. They're full of wonderful foods, lots of fruits and vegetables, and it just is, something that's beneficial for our kids when they're off campus for 3 to 5 days. Next slide, please. At our elementary, we have kids on campus 5 days a week. It's a hybrid, so we have half day AM, half day PM, or all day extended learning students. The challenge that we've come across is the amount of time that kids are actually on campus, except for those extended learning students, has pretty much taken away our ability to have a breakfast program on campus, an on-campus time to feed students. We were challenged with this and decided to, since we have breakfast programs at all of our school sites, we decided to manipulate our breakfast into a grab and go, as shelf stable as possible item. So we pre-package, and you can see some of the pictures down on the slide there. We pre-package a fruit and a shelf stable entree together. Those items go with a lunch as a student comes through the lunch line. So this gave us the ability, with the flexibility of the waiver for meal times and what have you, to be able to continue our breakfast programs. We've stood very firm with our principals on how our service models are going to be at our elementary schools. We have speed lines at a vast majority of our schools, but we've chosen to do one-sided. And that has been okay for us. We have some struggles at some schools, but it's working out really well at the vast majority. We've, again, pared down our menu quite a bit, and we're choosing to pre-pack in a sense, or pre-box an entree and a fruit, or, you know, certain items to make the lines move faster. The kids still have offer versus serve abilities. They can choose a different fruit or a vegetable or add their milk in there, but they're not touching. So no touch in the lines. We're serving them. We're not doing a la carte, as I said, at our secondaries. We're not doing it at our elementaries as well. So we're losing out on that revenue stream, and being a lower to mid free and reduced district, that's been a challenge for us, especially even with universal meals. You know, not everybody still wants to come and eat with us. We typically would serve about 24% of our enrollment, and now we're doing about 21%. So not horrible, but still not where I'd like to see our program. Again, some of our challenges, again, shorter time frames. So really work with those principals and let them know what your challenges are. Some of them are a little bit more flexible than others. Some of them are like, absolutely no, this is how it has to be. We've had to pull employees in to assist because some of our elementaries just have one cashier typically serving. So we've had to pull other employees in to assist with service because breakfast has increased. It's going with lunch. It's just a weird anomaly. And then no point of sales means no alert messages. So any diet changes, special diets, allergies, things like that, you really have to work with your school site nurses, administrators, and your cashiers and or food service workers to make sure they know who these kids are. They're masked. They don't talk too much anyway. And so they need to be able to say, I'm so-and-so and I'm gluten-free, or something like that. Next slide, please. Next slide, please. Thank you. So we also do weekly meal kits. We're doing 7 days. It's every Monday. We have bus routes, and then we also have our central kitchen that has 2 times for pickup. It includes breakfast, lunch, fruits, vegetable, and a half gallon of milk. Most of our items are frozen, entrees and things, and then we have a dry bag that has all of our fruits and veggies and any shelf-stable items. So when a family comes, if they're getting 2 meals for 2 kids, then they're going to get 4 bags and 2 half gallons of milk if that's what they want. Forecasting has really been kind of up and down. There's no rhyme or reason to our numbers sometimes. And then we have a challenge with freezer and refrigerator space. Our central kitchen is not conducive to the district. So we have to be very mindful about how we pack things and just making sure we're not packing too far in advance, because that offsets the rest of our production space-wise as well. We've had to pull secondary staff in to assist us with deliveries and our bus routes on those Mondays that the secondary teams are virtual, and just making sure that we are equitable across the district. You know, we've had some challenges with how large our district is, and families not necessarily being able to drive to our district offices and or bus stops. So that has been one of the biggest challenges for us. Next slide, please. We're wrapping it up. And staffing challenges, you know, contact tracing for those who may have come into a quarantine situation or may have gotten the virus. That has been a challenge for us. Working ahead as much as possible, but maintaining that spatial awareness of our refrigerators, freezers, and then having backups if in fact something was to happen, just knowing that you have something individually wrapped or shelf stable to make sure that you have that backup if you do have a school site go out or part of your central kitchen. Next slide, please. This is a little quote that our accountant shared with me, and I thought it was pretty poignant. You know, we have too far to go, sighed the boy. "The tree is not far," said the horse. "No, it's not." "Then let's aim for that." So choose those small pieces that you can shoot for, those small goals, and just be proud of when you get to those small goals, because this has been a doozy of a year. So thank you all very much. And please feel free to reach out if you have any questions. Our team has a ton to share if there's anything needed. So thank you very, very much.
Thank you so much, Kristen, and to all of our panelists. So I'm going to spend the next few minutes reading the questions from the chat. So I'm going to start with questions that were for our first speaker, Azusa. Hopefully I'm pronouncing your name correctly. So one of the questions that we received from the chat was, how can people apply for the Kids Marker program when it reopens? He's on the line. Or if anyone else can answer that question.
Hello?
Yes, hi.
Hi, I'm so sorry.
No,
What was
it's
the
okay.
question?
The question was, how can people apply for the Kids Marker program when it reopens?
For the Kids Market program, it would be the same way. And we basically base it on low income schools. So we go by the lowest income school when they express interest. That's how we choose them.
Great. And then we had another question. It was, how do we know if our district is already part of the Farmers to Families Food Box program?
How do you know if you're part of the Farmers Fund?
Which
district is it? Is it just in general? You're just asking?
Oh, that was another question that we got from the chat. It was someone asked if their district is participating in that program.
Okay, well, they can either ask their district if they're participating, or they can contact us. They can email me and I'll let them know if their district is already participating.
Great, okay, thanks.
Bettina, it's Betty.
Oh, hey, Betty.
Hey, so from the district perspective, USDA awards all of the farmers to families to county areas. And so what you need to do is just look on the USDA list. And Feeding America has been a wonderful partner. Should they have the resources, are the boxes that are not allocated. And anybody can reach out to me and I'll share everything I've done on the hustle to get those boxes for my families.
Thank you so much, Betty, for that. I think there was another question on how can we work with No Kids Hungry? So if anyone from the team can maybe share like an email address of someone, I think Neshat asked this question, who I know he lives in LA County. So if someone from No Kids Hungry can say, who would be the best contact for him to reach out to you? I know a couple of you cover different districts.
Yeah, I can put my email in the chat, and it'll either be, depending on where they're located, Janelle or myself.
Perfect. Thanks, Andrea. Okay, so the next two questions are on PEBT. So this is for you, Angelise. One of the questions we received was, we are having a lot of questions on why they did not receive their EBT cards if they received it back in June. So maybe they're referring to the 2.0. If they got it in June, why didn't they receive it now?
So one of the cases might be if in June they needed to change their address, that didn't get recorded and they need to change their address this time. So for all of the families who changed their address the first time, because they cannot fix or manage the database, they take the database directly from CalPATS and the CDE. Then the families who change the address, they need to call again and change the address. And they are continually addressing those issues. So please feel free to call that number. And also you can send me an email if you need more help. And you can also get more PBT updates on our website at nourishcalifornia.org.
Great. And then kind of contingent on that, someone asked the best number to call when families have problems with their PEBT card. I'm assuming that's the state's website.
Yeah, and there is in the slide, I put the phone number that is the best, so everybody will have it. And you can also reach me if you need any extra help with a lot of cases that your school is having.
Okay, thank you so much. Okay, so Betty, you had two, and I believe you already answered one, but I'll just read it out loud anyway. So one question was, how's overall meal participation compared to last year? And you responded with meal participation has exponentially been up from the pandemic since we have shifted to a single day serve, providing 28 meals a day for each person. Had one for Kristen. How are you handling program integrity now that you are serving on and off site?
Hi. Well, on site, it's fairly simple since there's not a lot of time for the students to come through the line. They go through one time and then they're kind of shuffled on to a different area. There really is no opportunity for them to come back through to potentially get a second meal or anything like that. So we use clickers or tally sheets to ensure our numbers and then match with production. At our meals pickup sites, our distribution sites, we have shorter pickup windows and they're spread out throughout our district. So, I mean, it is potentially possible for somebody to double dip or triple dip if they're really, really mapping out their route, but it's not something that we've seen during the school year so far. And so for those new families that might come up to us, if they do not have their children in the vehicle with them, we ask them proof that they're picking up for kids. It could be a family photo with them in it with the kids, or a report card, any kind of information that shows us that they are picking up for children. That's been, for the most part, how we're doing things. We do have a lot of new families that come periodically. They'll find out, oh, it's free, and oh, it's 7 days now. And so they'll show up to pick up meals, and they might not come back again for another week or two. So it just depends. We're doing, the best we can with what we have available to us. And so far, I think our team is doing really, really well with the program integrity piece of things.
Okay, great. Thank you so much, Kristen. I think we are, I think there was when I answered, I have one more question. I know we're very tight on time. This is from Zaria. To clarify, how do you make sure the students that are at the site don't also get the 7 days of meals? I'm not sure if that one was for Betty or Kristen.
That would be for Kristen because she has kids on campus.
Got it. Okay.
The 7-day meal kits are not served on campus. They are off-campus sites where we're distributing those 7-day meal bags. So the only meal kits that students on campus could receive would be that take-home breakfast at the elementary level, unless they decide to eat it as a snack or something later in the day at school, or at the secondary level, a bag that is for the next day or two that the student may be virtual, not on campus. So our 7-day meal kits are actually only available at our central kitchen and then 5 different bus stops that are not correlated with school sites at all. So families literally have to come and pick those up completely separate.
Okay, thank you so much. So I think we're right at 3:30. If anyone has additional questions, you can email the No Kid Hungry California at strength.org. The email address is listed on the slide here. And I believe I'm going to pass it over to Matt Upton.
Hey, everybody. 322 days ago is when we began this serving at the curb. And we've gone through this season of shift to a season of serve. And if there's been one statement that I've heard over and over and over again as I've helped serve 1.3 million meals alongside of each of you. It's been this: I'm looking for when stability comes. I'm looking for when my new normal gets here. And I believe we're in a time where stability, even in the midst of all the shifting, all the challenges, and everything that is occurring, I believe that we can step into stability. I'd like to give us 5 steps to do that. The first one is we just have to start stepping in that direction. All too often, what we do is we sit waiting for some change. We sit waiting for something. I like what Daryl said when he said we need to control the controllables and let everything else go. What we need to do is just begin to stepping in that direction, just step in that direction of stability. We need to think about what it looks like to be stable. And then we need to just imagine what it's like and then move in that direction and float in that direction. Step number two is transfer our energy to forward motion. All too often, what we do is we spend a lot of time thinking and hunkering down around all the changes, what they're not doing, what the district partners ought to do, what everybody else should do, what we could have done, what we would have done. Yet really the most powerful force that we can have is when we transfer that energy to forward motion. Step number 3 is elevate towards our desired outcomes. Instead of spending all this energy, giving all this oxygen about how they're not supporting us, how we didn't get this check, how they didn't show up, how many people have been tested positive, just really transfer our energy towards our desired outcome. If it was a math formula, I think it would go like this. It'd be thought plus focused attention plus directed action equals desired outcomes. When we put those 3 things together, thought plus focused attention and desired action, we put all those 3 together and we move in a direction, we get our desired outcomes. And and certainly so, we're looking for some stability. I believe that we're in that space. So step number 1 is just begin, just start. Step number 2 is transfer the energy into forward motion. Step number 3, elevate towards our desired outcomes. And step number 4 is plan ahead. Plan ahead. We're all great leaders and great influencers, and we know from our experience over these last 322 days, there's going to be further shifts, further situations. And so as we plan ahead, great things can come out of that. And then step number 5 is stand in your serve. I love what Kristen said. We just decided to stand firm in our style and keep on serving and keep on doing that, regardless of what everybody else was saying. And I believe there's great power in that as we just stand in our serve. So those are the 5 steps. It is such an honor to be here with you. You can always reach me at 916-708-8103 for anything, any way that I can help you become more stable and stand in that and those steps towards that. I want to do that. Thank you, Quad County Collaborative, for letting me be here today.
Thank you, Matt. It's nice to see you outside of 7:07 in the morning. Everybody can catch Mr. Upton if this is the first time hearing him. He's 7:07 a.m. live every day on his Facebook feed. I wanted to, first of all, say thank you. Thank you so much to all of the speakers that volunteered to continue our Quad County, our 4-county collaborative voice. It was my dream that we could open the door of an honest dialogue and start sharing everything that was going on. Daryl, I am going to go buy some cards and I need to start writing cards to my team. My team, their spouses have died, their parents have passed, and it's hard to know exactly what to do. And I am left with the thought that, you know, alone we are a drop. Together we are the ocean. So it's time to start swimming in the deep and getting a lot of good work done, keeping all of our kiddos safe from hunger, whatever the USDA regulations, whatever the CDE audits and everything else that we are traveling through. Together, we are stronger. You'll be getting a survey, a Quad County collaborative survey to identify what you've enjoyed about the Quad County. This is our third webinar. Thank you, No Kid Hungry, for sponsoring this, and to all 4 county leaders. And we are interested in hearing from you as to what you would like to see from us next. And thank you to all the leadership. There has been countless meetings behind the scenes to put this together. So without further ado, go have a great day. Thanks so much. Take care. We love you.